Hi, I'm Morse, the founder of Core Elements Training. In this video, we're going to demonstrate cupping technique, or using the vacuum cups whilst producing functional movement. And the movement that we're going to do is the compound exercise of the squat. This is a really great way of helping to decompress the muscle tissue, producing a functional release within the tissue, which is great when it comes to helping to release the muscle in the alignment of the movement that the client is doing. This would be great if your client might be experiencing generalized knee pain, and more specifically knee pain whilst they're doing the squat movement, because this will help to then release that muscular related tension in alignment with the movement that they're trying to produce. Also, because this is a compound movement, we're going to be relieving tension in a functional way on both sides of the limb at the same time. So because we're doing a movement technique, we need to have medium on, because the cups are going to slide when the client is moving. So we're going to apply a small amount of medium to the quads and to the hamstrings, and also to the gastrocnemius. The reason that we are placing cups on the gastrocnemius as well is that that muscle also crosses the knee joint. I'm going to use lotion today, and this is the Physique lotion, but you could use any medium such as oil or such as wax as well. So it doesn't really matter which medium you're using. Okay, so I'm going to, if you come towards me slightly, Katie, I'm going to place a bit of medium onto quads. It doesn't need to be fully massaged in. Absolutely, you could spend a bit more time applying the medium and massaging it into the tissue. Okay, so we've got quads, hamstrings covered, and also a bit of medium there onto gastroc. Okay, the cups that I'm going to use here are the Dongbang cups, and it's a vacuum set. We've got the pump here, so it's quite nice in the way that we can measure the amount of suction that we're putting into the cups by using this pump. Okay, so I'm just going to place 2 cups right in the middle of rec fem here. We could play over time with the positioning of these cups as well, making sure that we're covering the vastus group 2. And if you just spin round for me, please, Katie. Excellent. And then we are going to come into middle of the hamstrings. Again, we could work out with our clients got more tension, maybe into biceps femoris or the semis group. Okay, but for the purposes of today, I'm just going straight in the middle of the group. And onto the other leg. And last cup here onto gastroc. Okay, now just before she starts the movement, quite often when we do these movement techniques, the cups may come off, or you might see 1 or 2 of the cups pinging off. That's absolutely fine. We can still continue with the movement. Then we can come back to the center and then reapply those cups. But before she moves, I'm just going to make sure that these are all on nice and firmly, which they are. Okay, so then Katie is then going to come into that squat position. We can play with our different types of squats and play with those foot positions, but we're just going to come into our basic squat at the moment. So when you're ready, excellent, and lowering, brilliant, and coming down. How's that feeling? Good. So if one of the cups comes off, that's fine. Carry on with that movement. So Katie's just done 3 movements there. Okay, excellent. Then I'm just going to pop a little bit more suction into each of those. And then she's just going to go back down into that squat. Perfect. She might find first time round that it feels quite difficult, or she might find that it feels more comfortable in one direction than the other direction, depending on where she's holding her tension. Excellent. How's that feeling?
Yeah, it feels good.
Excellent. Okay, so generally as a rule of thumb, we're going to do 3 to 6 repetitions of that movement, and then we might do 1 or 2 sets as well to get that functional release. First movement is going to feel quite restricted, but then as that stretch reflex kicks in, the movement is going to increase around the associated joints and it's going to feel more comfortable for the client. We could also do a lunge movement too with these cups on. So these cups are still quite nice and firm. They're going to be in the same position as for doing the squat, but in this instance the client's going to come into the lunge position. Excellent. So just coming up onto those toes at the back, making sure that posture's nice and upright, and again feeling the differences on each of those legs. One leg will feel like it's stretching more, whereas the other leg is going to feel that it is working harder. Ideally, again, if your client is experiencing generalized knee pain, you're taking note of when that pain might be kicking in. But again, 3 to 6 repetitions and maybe 1 to 2 sets in the lunge and in that squat exercise. So this is producing that functional release, decompression of muscle tissue, helping to increase range of motion at the joint, reducing tension and increasing blood flow and nutrient content.